Hey, welcome to UroNurse News. I'm Vic Senese. Today, a new nationwide study is raising important questions about how generative AI, tools like ChatGPT, Grok, all those, may be affecting mental health in the U.S. Researchers found that daily AI use is linked to higher rates of depressive symptoms, especially among middle-aged adults. Let's break down what this study found and what it does not yet prove. Well, I'll tell you one thing. If it's showing that high usage of AIs cause depressed, I should be depressed, but I don't think I am. The study, published in JAMA's Network Open, analyzed survey data from more than 20,000 adults across 50 states and Washington, D.C. Researchers looked at how often people use generative AI, what they used it for, and how that use related to symptoms of depression, anxiety, and irritability. First, some context. Since the public release of ChatGPT in late 2022, generative AI use has exploded at work, at school, and at home, and in my office. While many people report benefits like productivity and convenience, concerns have emerged about potential mental health effects, especially with frequent or prolonged use. The study is one of the largest attempts so far to examine those concerns systematically. Here's what the researchers found. About 10% of U.S. adults reported using AI at least once a day. Once a day. Roughly half of those users said they used AI for work. But the vast majority, nearly 90%, reported personal use such as chatting, advice seeking, or entertainment. Daily AI use was more common among younger adults, men, people with higher education and income, and those living in urban areas. Now, the key to finding. After the adjusting for age, income, education, and other factors, daily AI users reported higher levels of depressive symptoms compared to non-users. This increase was statistically significant, but modest. Still, when applied to millions of users nationwide, even small effects may matter. I gave a talk on AI a while back to a group of retirees, and all of them were using AI, so it's pretty common now. Age turned out to be essentially important. The strongest associations were seen in adults aged 25 to 44 and 45 to 64. For adults aged 45 to 64, daily AI had about a 50% higher likelihood of reporting moderate or greater depression. Notably, the association was not significant among younger adults under 25 or adults over 65. Aha! I'm over 65. Researchers also examined anxiety and irritability. Daily AI use was linked to slightly higher anxiety scores and greater irritability, showing a consistent pattern across multiple mental health measures. A critical question: is AI simply another form of social media? Researchers looked closely, and the answer appears to be no. They found no meaningful correlation between AI use and social media use and posting frequency. Even after adjusting for social media behavior, the association between AI use and depressive symptoms remained. Another important finding: how AI is used matters. When researchers separated AI use into work, school, and personal use, only personal use was associated with higher depression scores. I use it all for work. Work-related and school-related use symptoms showed no significant association with depressive symptoms. So, what does this mean? First, this is crucial. This study does not prove causation. That's always the thing. Is it the chicken or the egg? We do not know whether AI use contributes to depression. Depression leads people to use AI more, or whether both are influenced by another factor entirely. This data is cross-sectional, meaning it captures a snapshot of time. The authors are clear. These findings do not suggest people should stop using AI, nor do they imply that AI is inherently harmful. Instead, they highlight the need for longitudinal studies, randomized trials, and closer attention to who uses AI, how often, and for what purpose. So here's the takeaway. Generative AI is now a part of daily life for probably most of us, but millions of Americans. This large national study suggests that frequent personal AI use is associated with modest increases in depressive symptoms, particularly in middle-aged adults. So if you notice you're feeling a little sad and using a lot of AI, you may want to consider looking into getting some help. As AI continues to expand, researchers say mental health outcomes should be measured alongside productivity and innovation. This message isn't panic but awareness. As with social media before it, understanding how we use new technology may be just as important as to how much we use it. I'm going to watch this and follow the research as more becomes available because, of course, this affects me personally. Hey, tomorrow on UroNurse News, new research suggests genetics may influence lifespan far more than we ever thought. I always thought it affected it. What does science really say, and what does it say? What doesn't it say? Join me as I break it down in the study. Join me as I break down the study, separate the facts from hype, and explain what this means for patients, families, and healthcare professionals without the jargon. Hey, if you've been enjoying the ending with that testosterone-infused me singing, here it comes.
UroNurse News. Let's learn and share on YouTube, LinkedIn, X, and Facebook. Everywhere, 5 minutes of wisdom for healthcare workers everywhere. Bringing insights through the years.